For decades, you have been told that chocolate is off the table, that every square is a threat to your blood sugar. That discipline means saying no. But here is what nobody tells you. There is a form of chocolate sitting on your grocery store shelf right now with a glycemic index of just 22, lower than an apple, lower than a bowl of oatmeal. And researchers at some of America's most respected medical institutions have documented its ability to improve insulin sensitivity, reduce the inflammation driving your diabetes forward, and even support the cells in your pancreas that produce insulin. If you are over 60 and have been avoiding chocolate for years because of your blood sugar, this conversation is for you. I am Dr. Daniel Brooks, and with me today is Dr. William Carter, a physician with 33 years of experience helping older adults manage metabolic health, cardiovascular risk, and the very real challenges of living well with type 2 diabetes. Dr. Carter, millions of Americans over 60 have been told to stay away from chocolate completely. Is that advice actually supported by the science?
Daniel, that is exactly the right question to open with. And the honest answer is that the blanket advice to avoid all chocolate is not supported by the current evidence. What the research does support is something far more specific. And once people understand the distinction, it changes everything. There are 5 specific types of chocolate that the clinical evidence actually backs for people managing blood sugar. And later in our conversation, I want to make sure we get to number 5 on that list, because it is the least expensive of all 5, and it carries the strongest clinical evidence of the entire group by a meaningful margin. But before we name a single one, there is something I need to walk you through first, a foundational piece that most people miss entirely. And without it, the 5 types will feel like a random list. Once you understand it, every single one will make complete biochemical sense. The short answer is yes, Daniel, but only if you understand one distinction that almost nobody explains clearly. And that distinction is this: the benefit is not in chocolate. The benefit is in cacao. Those are 2 very different things. A mass-produced milk chocolate bar loaded with sugar, hydrogenated oils, and barely any real cacao has almost nothing in common with the cacao bean itself, except a vague resemblance in flavor. The healing compounds live in the cacao. The commercial bar simply borrows its name.
So, what exactly are these compounds inside cacao that make such a difference for someone managing blood sugar after 60?
Cacao contains a concentrated group of plant compounds called flavonoids. The 2 that matter most for blood sugar are catechin and epicatechin, and they work through 3 specific mechanisms that act directly on type 2 diabetes. The first mechanism is improving insulin sensitivity. I want you to picture insulin resistance like a radio signal that has become too full of static. Insulin is transmitting. Glucose is waiting at your cells, ready to come inside, but the cell wall cannot receive the message clearly anymore. Cacao flavonoids work on the lining of your blood vessels, what we call the endothelium, and they help clear that static so your cells can finally respond to insulin the way they are supposed to. The second mechanism is reducing oxidative stress. Cacao ranks among the highest foods ever measured for antioxidant capacity. And oxidative stress is not abstract. It is one of the central reasons your insulin receptors stop functioning properly. Bring oxidative stress down, and those receptors begin working again. The third mechanism is the one that genuinely changed how I think about this food entirely.
You mentioned a third mechanism that even surprised you after decades of practice. What is it, and why does it matter so much for people with type 2 diabetes?
Epicatechin, the most abundant flavonoid in cacao, has been shown in cellular research to stimulate insulin secretion and support the regeneration of beta cells in the pancreas. Those are the cells that actually produce insulin. In type 2 diabetes, they slowly get worn down over the years. The idea that a natural food compound could support bringing those cells back rather than simply compensating for losing them is a genuinely different conversation. A 2015 analysis supported by Harvard T.H. Chan School of Public Health found that higher flavonoid intake was consistently associated with improved insulin sensitivity and lower risk of developing type 2 diabetes in adults over 50. That kind of population-level evidence is not something we see often with a single food group. Now, I should mention something here that always gets a laugh in my clinic. I have had patients come in practically glowing, telling me they have been eating chocolate every day for their health, and I have to gently ask them to show me the wrapper. 9 times out of 10, it is a milk chocolate bar with more sugar than a candy bar. So yes, cacao is powerful. but the delivery vehicle matters enormously.
So before we name the 5 specific types, how do people actually tell the difference between cacao that helps and chocolate that harms, right there on the label?
The answer is on the back of every package, and it takes about 30 seconds to find. Flip the bar over. Look at the ingredient list. The very first word must be cacao mass, cacao paste, or cocoa mass. If the first word is sugar, the bar is not what the front label claims, regardless of how dark it looks or how healthy the packaging appears. The front of the package is marketing. The ingredient list is the truth. And once you know that, you will never read a chocolate label the same way again. Which brings us to the first of the 5 types. And this one is the easiest place for most people to begin tonight.
You mentioned the first type is the easiest place to start tonight. But I have to ask, because most of our viewers have heard conflicting numbers their whole lives. What is the actual glycemic index of 70% dark chocolate? And how does that number compare to foods we eat every single day?
The glycemic index of good quality 70% dark chocolate sits at around 22. To put that in perspective, white bread comes in at 71. Table sugar is 65. Even a bowl of plain oatmeal, which most people consider a healthy breakfast, sits around 55. So a square of quality dark chocolate produces a slow, gentle rise in blood sugar, not the sharp spike most people assume. The reason is straightforward. At 70% cacao, there is far less sugar in the bar, and what remains is balanced by cacao fat and cacao fiber, both of which slow digestion considerably. I had a patient named Patricia, 65 years old, a retired school teacher from Portland. She came to me with a fresh pre-diabetes diagnosis and an A1C of 6.1. She had been eating 3 or 4 pieces of milk chocolate every night after dinner for years and felt guilty about every single one. I did not tell her to stop. I told her to switch. 2 squares of 70% dark chocolate after a dinner with protein and fiber. 3 months later, her A1C was 5.7. But what moved her most was something she told me quietly. She said she had finally stopped hiding chocolate in her kitchen drawer. That moment stuck with me. Research published in the American Journal of Clinical Nutrition found that regular cacao consumption is linked to meaningfully reduced cardiovascular risk. That matters enormously for people with diabetes, because diabetes already doubles or quadruples the risk of heart disease.
So, if 70% is the starting point, you mentioned 85% is actually a completely different clinical conversation. What changes at that threshold that makes doctors pay closer attention?
This is where it gets genuinely interesting. As the cacao percentage rises, 2 things happen simultaneously. The flavonoid concentration increases, and the sugar content drops significantly. But the more important shift at 85% and above is what happens to inflammatory markers. Chronic low-grade inflammation is one of the hidden engines of type 2 diabetes. It quietly damages insulin receptors, accelerates arterial stiffness, and makes blood sugar control progressively harder over time. A study published in the Journal of Nutrition in 2012 found that daily consumption of high cacao dark chocolate was associated with significant reductions in inflammatory markers, including C-reactive protein in adults with metabolic risk factors. Here is the label trap that catches people at this level. Many products marketed as diabetic-friendly actually contain maltitol, a sugar alcohol that behaves almost identically to regular sugar in the bloodstream. The word diabetic on the front label means almost nothing. Flip the bar over. Read the ingredient list. If you see maltitol anywhere on that list, put the bar back on the shelf.
Dr. Carter, you just warned us about maltitol hiding in so-called diabetic chocolate. But I understand there are 2 more types that eliminate sugar from the equation entirely. What are they, and who are they actually best suited for?
The third type is 100% cacao chocolate and cacao nibs. 0 sugar, nothing added. Now, I will be honest with you. Eaten straight, 100% chocolate tastes like something between very strong espresso and a piece of chalk. I have watched patients try it for the first time, and their expression tells the whole story. But here is the key. You do not eat it straight. You use it as an ingredient. 1 or 2 squares of 100% cacao stirred into plain full-fat yogurt. A small handful of cacao nibs scattered over oatmeal in the morning. A piece broken into warm, unsweetened almond milk on a cold evening. Used that way, it delivers the highest flavonoid concentration of any solid chocolate form with essentially 0 impact on blood sugar. It is ideal for people who are further along in managing their condition and want the most direct therapeutic benefit.
You mentioned earlier there is one specific sweetener hiding in many sugar-free chocolates that actually spikes blood sugar almost as badly as regular sugar. Most people have never heard of it. What is it, and how do people spot it before they buy?
Maltitol. That is the one. And it is one of the more frustrating things I encounter in clinical practice because it is used in a significant percentage of products marketed specifically to people with diabetes. Maltitol is a sugar alcohol, and sugar alcohols as a category have a reputation for being blood sugar friendly. Some of them genuinely are. Erythritol, for example, has a glycemic index of essentially 0, and a study published in the European Journal of Nutrition in 2018 confirmed it produces no meaningful insulin response in healthy adults. Stevia similarly has no blood sugar impact. Maltitol, however, has a glycemic index of around 35 to 52 depending on how it is processed. That is high enough to produce a real blood sugar response, particularly in someone whose glucose regulation is already compromised. So type 4, the one I do recommend, is sugar-free chocolate, sweetened exclusively with erythritol or stevia, not maltitol. Not a blend that includes maltitol. The label needs to clearly show erythritol or stevia as the sweetener, and nothing else alongside it. Here is what nobody tells you about this category. Even products with clean sweeteners sometimes add palm oil or modified starch as a texture agent, and those ingredients quietly raise the glycemic load of the product. So, once you confirm the sweetener is safe, scan one more time for those hidden additions before you put it in your cart.
Dr. Carter, from the very beginning of our conversation, you mentioned that number 5 is the least expensive option and carries the strongest clinical evidence of all 5 types. After everything we have covered, I think our viewers are ready. What is it?
Pure, unsweetened cacao powder. That is it. You can buy a large container of it for roughly the same price as a single premium dark chocolate bar, and it consistently outperforms every other form of cacao in clinical research by a meaningful margin. The reason comes down to manufacturing. Producing a chocolate bar requires pressing, conching, and tempering. Every one of those steps degrades a portion of the flavonoid content. Pure, natural cacao powder, the kind that has not been alkalized or Dutch processed, skips most of that degradation. Think of a quality dark chocolate bar like fresh orange juice from a carton. There is still genuine nutrition there, but pure cacao powder is the whole orange pressed the moment you need it.
You mentioned a specific systematic review that actually changed how you prescribe cacao to your own patients. What did that research find, and why did it shift your thinking?
A systematic review conducted by researchers at the Universidade Federal Fluminense in Brazil, published in 2021, analyzed 7 clinical studies examining the effects of cacao flavonoids on blood glucose and serum insulin in people living with type 2 diabetes. The consolidated finding was this: cacao powder or dark chocolate at a dose of 25 to 30 grams per day showed beneficial effects on blood glucose and on hemoglobin, A1C, along with cardiovascular protection through improved HDL cholesterol. Now, I want to make sure people understand what an A1C finding actually means. A 1C is not a snapshot. It reflects your average blood sugar control over 3 full months. When a dietary change moves that number, you are looking at a real, durable shift in how the body handles glucose, not a short-term fluctuation, a structural change. I had a patient named Beverly, 69 years old, 5 years into type 2 diabetes with an A1C that had been parked stubbornly at 7.0 for 2 full years. She was taking her medication faithfully. She was walking every day. She told me almost in tears that she had tried everything. I changed one thing, just one. The sugar and creamer in her morning coffee became 1 tablespoon of pure cacao powder, a few drops of stevia, and unsweetened almond milk. 6 months later, her A1C was 6.5, 1 tablespoon, 1 cup, every morning. That is the power of consistency over complexity. The label rule here is the simplest of all 5. The ingredient list should contain exactly 1 item: cacao powder or cocoa powder, nothing else. Avoid any product labeled hot chocolate mix, drinking chocolate, or flavored cocoa, regardless of what the front claims.
Dr. Carter, before we close, you hinted earlier that there is something almost no physician discusses with diabetic patients about food and psychology. Something that may actually be driving worse blood sugar control in people who are trying hardest. What is it?
Chocolate guilt. And I say that with complete clinical seriousness. Studies in nutritional psychology have shown something that genuinely surprised me when I first encountered the research. People who feel guilty after eating tend to eat more in the hours that follow, not less. The guilt triggers a cycle of restriction, intense craving, and rebound consumption. And that cycle produces worse blood sugar control over time than a calm, planned, portion-controlled inclusion of the food you actually want. I want you to picture two patients sitting in my clinic. Both of them eat the exact same 2 squares of 85% dark chocolate after dinner. One of them understands the glycemic index is 22. She knows the flavonoids are quietly improving her insulin sensitivity. She enjoys the chocolate, finishes it, and moves on with her evening. The other believes she is damaging her health with every single bite. Her cortisol rises, her guilt rises. And by 10 o'clock, she has eaten 3 more squares she never planned to touch. Same chocolate, same body, completely different outcomes. The knowledge changed the experience, and the experience changed the behavior.
So, what does smart, sustainable usage actually look like in practice for someone over 60 managing type 2 diabetes, and who should be careful or avoid cacao altogether?
In practice, the most effective approach has 3 components. First, portion discipline, 20 to 30 grams per day. That is roughly 2 to 3 small squares of dark chocolate or 1 tablespoon of cacao powder, not more. Second, timing. Consuming cacao after a meal that already contains protein and fiber significantly blunts any residual glycemic response. Do not eat it on an empty stomach. Third, consistency over perfection. 1 tablespoon of pure cacao powder in your morning coffee every single day for 6 months outperforms occasional large amounts every time. Now, who should be cautious? People taking high-dose blood thinners such as warfarin should discuss cacao intake with their physician because flavonoids can have mild antiplatelet effects. People with advanced kidney disease need to be mindful of the oxalate content in cacao. And anyone with a known sensitivity to caffeine should start with a very small amount because cacao does contain trace caffeine and theobromine. And one more thing I tell every patient before they leave. The goal here is not perfection. The goal is a calm, informed relationship with food. Sustainable diabetes management over years and decades does not look like iron willpower and endless restriction. It looks like the right choices, made quietly and consistently, day after day.
Dr. Carter, let us bring everything back to where we started. 5 types. 1 clear framework. What is the simplest way for someone watching tonight to remember all of this and actually take action?
Start with the back of the label. Always. That one habit protects you across all 5 types. Here is the framework in plain terms. Type 1. 70% dark chocolate, your easiest entry point, glycemic index of 22, cacao mass must be the first ingredient. Type 2. 85% and above, where the anti-inflammatory benefits shift meaningfully and the clinical evidence deepens. Type 3. 100% cacao and cacao nibs, 0 sugar, best used as an ingredient rather than eaten straight. Type 4. Sugar-free chocolate sweetened with erythritol or stevia only, never maltitol. And Type 5. Pure unsweetened cacao powder, 1 ingredient on the label, the strongest A1C evidence of all 5, and the most affordable option on the shelf. Tonight, open your pantry. Pull out every chocolate product you own, flip each one over. Read the very first word in the ingredient list. If that word is sugar, set it aside. This week, pick up a container of pure, unsweetened cacao powder with exactly 1 ingredient listed. Start with 1 tablespoon in your morning coffee or oatmeal. And at your next appointment, ask your doctor a simple, direct question. Given my current A1C, could pure cacao have a place in my nutrition plan? That is a conversation worth having. And remember what we said about guilt. Sustainable diabetes management does not look like restriction. It looks like the right knowledge, applied calmly and consistently, day after day. You now have that knowledge.
Dr. Carter, this has been one of the most genuinely useful conversations we have had on this channel. Thank you for bringing the science and the real-world experience together in a way that actually helps people move forward. To everyone watching right now, if something in today's conversation shifted how you think about managing blood sugar after 60, please take 10 seconds and share this video with someone you care about. A spouse, a sibling, a friend who has been living under the weight of chocolate guilt for years, they deserve to know the truth. If you found value here, give this video a like and drop a comment below telling us where you are watching from and which of the 5 types surprised you the most. We read every single comment, and your responses genuinely shape what we cover next. And if you have not subscribed yet, hit that subscribe button now so you never miss a conversation like this one. Before we say goodbye today, I want to leave you with a quick health knowledge challenge. Because keeping your mind active and curious is just as important as keeping your blood sugar in range. Here is your question for the comments. We talked today about a compound inside cacao that research suggests may support the regeneration of the cells in your pancreas that produce insulin. Can you remember the name of that compound? And here is the bonus part. What is the one processing method that destroys most of that compound when cacao powder is manufactured? Drop your answer in the comments below. See how many of your fellow viewers get both parts right. I will be checking, and I always enjoy seeing the conversation that follows. We are honored to be part of your health journey. This channel is for educational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider before making health-related decisions. We will see you in the next episode.